Every year, more than 500,000 Americans undergo surgery for back pain. At the same time, many adults are told they wouldn't be good candidates, maybe because of age or weight. That's where a newer procedure can help. And the doctor recently had a huge success story in a Central Ohio man who saw him here on Daytime. And back with me on Daytime, we have neurosurgeon Dr. Hamid Abbasi with Inspired Spine. Good to have you back, doctor.
Very nice to be back.
Dr. Abbasi, I want you to give us a reminder of your back surgery technique. What makes it so different, so unique?
What makes it different is that we don't cause lots of collateral damage on the way of getting where the problem is. And most of the time, the problem is the disc that is between two bones and enable us to move. And that disc wears and tears, and we have to physically get there. Contrary to open surgery, where, for lack of other term, you have to fillet you open to get there, we do the surgery through a tube system that is barely bigger than a pen. And that enables us to bypass all the vital structure, practically keep them in place, no need for cutting bone and muscle. And by the way, by being able to do that, we are able to provide this kind of service, this kind of procedure on people who are much larger, and by definition, open surgery would need to cause way more damage to get where the problem is.
And to that end, you recently had a patient who saw you here on NBC4 on Daytime and flew out to you for surgery. I want to quickly hear from him. This is moments after he had back surgery from you.
I feel great. Like, I've had back surgery before and it was nothing like this. Like, I feel capable of moving. I was able to move mainly unassisted by the hospital staff. They were shocked that I could move so well, and I feel really good.
He was told by multiple doctors, we cannot perform this surgery. How were you then able to help them? What was that initial consultation like with him?
I want to emphasize, all those doctors that told him they cannot do surgery for him, they are good doctors. They know that surgery for him, in their hand, that kind of surgery can be a deadly surgery with somebody who's 500 pounds and has a BMI of 62.5. What that means that laying on your chest for surgery that 12 hours, practically you cannot recover, your lung cannot recover from that anymore. Whereas we did the surgery in under 2 hours, and that patient literally next day woke up with the pain being gone and ambulated. Our body just reacts very differently to a surgery that 2 hours than to a surgery that 12 hours. And that enables us to provide this kind of surgery for elderly, people who are much sicker than the average spine patient get this when they get their surgeries. By the time you are 70 years old, there's only 1 to 2% chance you don't have spine problem. This is not a rare disease that only 10 people on the planet are suffering from. This is a public health issue.
It really is, and I find it amazing that a lot of these people feel that they don't have anywhere else to turn, and then they find you. I mean, you even operated on a 92-year-old nun recently who thought, right, at this point, what am I going to be able to do to help me with my back issues?
I think what's very important is that just to understand that nun needed 3 to 4 people to help her to get through the life, meaning that sort of not only get lots of resources, but just imagine the feeling that you cannot be independent, and that sort of take the purpose of life away from you. If you cannot, if for basic thing, you need help. And that is a family thing. Lots of families suffer because everything is now about the taking care of the loved one. In my last visit with that nun, she told me the only thing she needs help with is when she turns her mattress from one side to another. I have no idea why somebody would do that, but I can tell you I couldn't do it by myself, so she's all right.
She's doing all right. And Dr. Abbasi, you are currently training surgeons all across the country to perform this technique so that people don't have to fly out just to you, right? That we can help so many more people with their issues. So your mission really is to then create surgeons that are able to do this all over.
And this has to be. It's unethical to sit on something that can change so many lives. We have 1,000 testimonials as a proof of that. This is a duty of any physician who can help patients, not only to help them, but as well facilitate that the other surgeon are trained adequately to provide that kind of care. And we are doing what's a tradition in medicine. So I cannot take too much credit for that.
But you are changing lives. That is clear. So inspiredspine.com. You can go to that website and find out how Dr. Abbasi can help you. Thank you so much for being with us.
Thank you very much. I appreciate your time.